With this rise in Lyme disease infections, you're likely thinking you don't want that and you want to protect yourself and others this summer. Dr. Allan Grill joins us now. He's the chief of the Department of Family Medicine at the Markham Stouffville Hospital. Doctor, I know you have treated patients with tick bites, with Lyme disease. What do you make of that surge in numbers in Lyme disease? Is that just because there are more of them this summer?
So there are definitely more ticks. With climate change and the warmer weather, they come out earlier. More ticks mean more bites. And I think healthcare professionals like family doctors and nurse practitioners, we're more aware of the symptoms of Lyme disease. And when we're more aware of the symptoms, we can diagnose more people.
When you talk about the symptoms, what are the ones we should be looking for? What are the really serious ones in particular?
So early on, if you're bitten by a tick that can infect you with Lyme disease, you can get fever, you can feel tired, you can get a headache. You can also potentially get this rash. It looks like a red target or like a bullseye that can spread on your arm. Later on, up to 30 days after being bitten, you can get swollen glands, heart palpitations, painful joints. And if you get any of those symptoms, please seek medical attention with your family physician or nurse practitioner.
So let's play this out a little bit. Past the 30 days, what are the risks here? How serious can this get?
So we want to make sure people that have been bitten and have symptoms don't ignore them, because the longer you ignore them, the worse the symptoms could get. People with Lyme disease have presented with sort of some facial palsy, similar to Bell's palsy, where you have paralysis of muscles. You can get chronic fatigue, where you're tired for weeks or months on end. And you can also get arthritis, or really sore and painful joints. So we want to try to get onto this as early as possible. This is a very serious disease.
Because those can all be chronic, right?
Yes, and we want to treat it early so that we prevent the symptoms from getting to be more of a chronic nature.
I suppose the thing is you actually don't want to be bitten in the first place, so how do we avoid that?
Yeah, there's definitely some things we can do to avoid getting bitten and infected. So first of all, we can avoid high-risk tick-infested places. These typically are wooded areas with tall grass or bushes. But because ticks can bite birds and then birds fly from one place to the next, you could get it in a city or in a playground, pretty much anywhere. Secondly, we can dress appropriately. So wearing shoes that are closed at the toe, we can wear light-colored long-sleeve shirts and pants because you can see the ticks and then flick them off. You can tuck your pants into your socks. And finally, we can use insect repellent that has DEET, different concentration for kids and adults, but it tends to keep the ticks away and other bugs like mosquitoes away.
So as we sit here talking, it's a bit creepy in the studio because these things are all around us and they, they look enormous. But walk us through what they actually look like in real life, what we're supposed to be looking for.
So ticks actually are very small. They range from the size of a poppy seed to a sesame seed. A little bit hard to see with the naked eye sometimes. We often recommend people use a magnifying glass when they're looking for ticks. The other challenge is when they're biting you, they often aren't painful. So you don't even know when you're being bitten, which makes it even harder when we're dealing with them.
And when you've got that magnifying glass, I mean, how do you actually get them off? Where are you looking? And then what are you looking to do once you see one, other than not panic?
Yep. So at the end of the day, what you should always do is check for ticks and then remove them. So firstly, check your kids, check your pets. They can jump from the dog to you. Check yourself. You want to check in areas like hairline, under the arm, groin, belly button. And typically, you want to take a fine set of tweezers, go close to the skin, and pull up and out. Don't twist, don't squeeze the tick. Clean the area with soap and water after. And we recommend at the end of the day, you take a shower to sort of wash off any other ticks that you might have missed.
So at that point, are you just saying, okay, it's out, now I just wait? I mean, how long do you have to wait? What do you do with that thing once you pull it out?
Yep. So typically, you can actually hang on to the tick, take a picture of it. You can actually download it to a website called etick.ca. They can help identify the tick that you found. It also has some wonderful information about this topic in general. But up to 30 days after you think you've been bit, you have to monitor for the symptoms we've talked about, and if any of them show up, see your physician. And even if you've been bitten, sometimes we'll actually treat people before they get symptoms, so seek medical attention.
One last thought. As we look at these generic ticks on the screen here, is there one tick in particular that is most commonly worried about here? Is there one that you're worried about?
Yeah. So with regards to Lyme disease, the black-legged tick, which is also known as the deer tick, is the one that we're worried about the most. So if it has black legs, and you're worried, please seek attention from your medical provider.
Get that magnifying glass.
For sure.
Dr. Grill, thank you.
My pleasure.